What if the signs were right in front of you, but you just didn't see them? It's something no one wants to think about. The final chapter of a loved one's life is not easy to face, and yet, many families miss the subtle warnings that someone may be in their final year. Not because they don't care, but because these signs are often quiet, easily mistaken for normal aging or just a bad day. And then one day, the realization hits, when there's nothing left to do but wonder if more could have been done. But here's the truth. Recognizing these signs isn't about predicting the future. It's about understanding what the body and mind go through in the later stages of life, and making sure the time that remains is filled with the comfort, dignity, and love that everyone deserves. Aging is a journey we all walk, but some changes are more concerning than others. As the body slows down, it begins to send signals, sometimes loud and clear, but often subtle and easy to overlook. A shift in appetite, a growing sense of fatigue, moments of confusion that seem unusual. These aren't just small changes, they could be silent warnings that someone's body is preparing for its final transition. And when we notice these changes early, we can do something incredibly important. We can be there. Not just physically, but emotionally. We can offer the right support, help manage discomfort, and most importantly, ensure that they never feel alone. Because when the time comes, the greatest gift we can give our loved ones is the knowledge that they were seen, heard, and cared for in the way they needed most. Today, we're talking about 5 silent signs that may indicate an elderly loved one is in their final year. These are not meant to alarm, but to inform, to help families recognize when small shifts may be pointing to something bigger. First, we'll look at one of the most common yet misunderstood changes, the sudden loss of appetite and unexplained weight loss. When someone who once enjoyed their meals begins picking at their food or pushing their plate away, it's often a sign that the body is slowing down in a way that needs attention. Next, we'll talk about a growing sense of fatigue and withdrawal, a deep exhaustion that goes beyond just feeling tired. If a loved one starts pulling away from conversations, skipping activities they once enjoyed, or spending most of the day resting, it may not just be aging, it could be the body's way of conserving its energy for what's to come. Then, we'll discuss noticeable cognitive decline or confusion. Forgetfulness can be normal, but when someone begins to struggle with recognizing people, following simple conversations, or remembering everyday routines, it may be a signal that their mental and physical state is shifting. Another sign is recurring infections or slow healing. The immune system naturally weakens with age, but when someone starts getting sick more often or their body struggles to heal from even minor injuries, it can be an indication that their system is working harder than usual to sustain itself. And finally, we'll explore shifts in breathing patterns. Shallow breaths, long pauses, or irregular breathing rhythms can be a signal that the body is changing in a profound way. Recognizing this early allows us to provide comfort and peace in a way that truly matters. Each of these signs on their own may not mean much, but together, they paint a picture that should never be ignored. So if you've ever noticed subtle changes in a parent, grandparent, spouse, or even a close friend, this is for you. The goal isn't to worry, but to understand. Because when we recognize these signs early, we can take steps to ensure the last phase of life is filled with the respect, comfort, and love that everyone deserves. Before we begin, if you haven't subscribed yet, now is a great time to do so. Turning on notifications ensures you never miss valuable insights that can help you and your loved ones navigate the aging journey with knowledge and care. And if anything we talk about today reminds you of something you've seen in your own family, we encourage you to share your experience in the comments. Your story might just help someone else who's going through the same thing. Now, let's begin. Sign number 1. Drastic decrease in appetite and weight loss. One of the first and most telling signs that an elderly loved one may be in their final year is a drastic decrease in appetite and unexpected weight loss. Food is more than just fuel. It's a reflection of health, energy, and even enjoyment. But when the body begins slowing down toward the end of life, its need for nourishment changes. Digestion becomes less efficient, and in some cases, the brain signals a reduced need for energy. The result? Meals that once brought comfort and pleasure are now met with disinterest or even avoidance. You may notice subtle shifts at first. Maybe a loved one who used to finish every bite now pushes food around the plate, taking only a few small bites before saying they're full. Perhaps a once favorite meal no longer appeals to them, or they start skipping meals entirely. Some may say, "I'm just not hungry," or "food doesn't taste the same anymore." Weight loss often follows. Clothes become noticeably looser, Cheekbones and collarbones stand out more than before. Family members may brush it off at first. Oh, they're just eating less because they don't move around as much. But a steady, unexplained drop in weight is rarely just a simple matter of appetite. It can indicate that the body is working differently now, prioritizing essential functions while letting go of what it no longer needs. This shift can be unsettling to witness, but it's important to approach it with care and understanding. For many seniors, eating becomes more of a challenge as they age. Chewing may be difficult due to dental issues. Swallowing can become harder, making certain textures uncomfortable. Even the senses of taste and smell can weaken over time, making food less appealing. And when eating starts to feel like more of a burden than a pleasure, it's natural to avoid it. So, what can we do? First, focus on quality over quantity. Instead of large meals, encourage smaller, nutrient-dense options. Soft foods like oatmeal, mashed vegetables, and yogurt can provide essential nutrients without overwhelming the appetite. Smoothies can be a great option, offering hydration and nutrition in an easy-to-consume form. Second, make eating as effortless as possible. If chewing is an issue, softer textures can make meals more enjoyable. Warm, comforting foods like broths and pureed soups may feel better than heavier dishes. If a lack of taste is making meals unappealing, adding mild herbs or natural flavors can help stimulate the appetite. Hydration is another key factor. When someone eats less, they often drink less as well, leading to dehydration, which can make fatigue and confusion even worse. Sipping water, herbal teas, or electrolyte-rich drinks throughout the day can help prevent this. It's also worth considering that sometimes, it's not just about food, it's about the act of eating itself. Many seniors lose interest in meals because they feel lonely at the table. If a loved one used to share meals with family but now eats alone, the experience can feel empty, reducing their motivation to eat. Simply sitting with them, even if you're not eating yourself, can make a difference. Recognizing these changes early allows families to step in and provide gentle support. Encouraging, rather than forcing. Offering, rather than insisting. The goal isn't to push someone to eat when their body is rejecting food. It's to ensure that whatever they do consume is nourishing, comforting, and easy to digest. Aging naturally comes with some appetite shifts, but a noticeable and persistent loss of interest in food is something we shouldn't ignore. It's a sign that the body is adjusting in ways that require attention and care. By recognizing this early, we can take steps to ensure that each meal, however small, still provides warmth, comfort, and nourishment in a way that truly matters. Sign number 2. Increased fatigue and withdrawal from activities. Fatigue is something we all experience from time to time. A long day, a restless night, or even just the natural process of aging can leave someone feeling drained. But when exhaustion becomes persistent, when it lingers no matter how much rest a person gets, it can be a sign that the body is shifting in a way that goes beyond simple tiredness. This isn't just needing an extra hour of sleep or feeling sluggish on occasion. It's a deep, unshakable fatigue that makes even the smallest tasks feel overwhelming. Things that were once effortless, getting dressed, walking to the mailbox, even holding a conversation, begin to feel like too much. One of the first signs families notice is withdrawal from daily activities. A loved one who used to enjoy meeting friends for coffee now politely declines invitations. Someone who always looked forward to family gatherings suddenly prefers to stay home, saying they're just not up for it. At first, it may seem like a mood shift, but over time, it becomes clear. It's not that they don't want to be involved, it's that their energy simply isn't there. Then there's the increase in napping. A short rest in the afternoon is normal, even beneficial, but when a senior begins sleeping for long stretches throughout the day and still feels drained, it's a sign that the body is conserving energy in a way it didn't before. You may notice them dozing off mid-conversation, falling asleep while watching TV, or going to bed unusually early. Fatigue like this can stem from a variety of factors. Sometimes, it's the body's way of slowing down as essential functions require more energy. Other times, underlying health issues, such as anemia, low oxygen levels, or even depression, can contribute to persistent exhaustion. And when energy levels drop, a cycle begins. Less movement leads to weaker muscles, which makes even small activities feel harder, which then leads to even less movement. So what can be done? One of the most effective ways to combat deep fatigue is gentle movement. While it may seem counterintuitive, Light physical activity, such as stretching, short walks, or even simple seated exercises, can improve circulation and boost energy levels. When the body stays in one position for too long, it can contribute to stiffness and sluggishness, making everything feel harder. Encouraging even small moments of movement can help break this cycle. Ensuring proper rest is also essential. Sometimes, extreme fatigue is made worse by poor sleep quality. Conditions like sleep apnea, restless leg syndrome, or frequent nighttime wake-ups can prevent true restorative rest. If a loved one seems excessively tired despite sleeping for long hours, it may be worth exploring whether their sleep is being disrupted. It's also important to consider emotional factors. Fatigue and withdrawal can sometimes be linked to feelings of sadness, loneliness, or even a quiet resignation to the changes happening in their body. In these cases, emotional support is just as vital as physical care. Simply spending time together, engaging in calming activities, or even just sitting with them in comfortable silence can provide reassurance. But what's most important is to listen to their limits. Encouraging activity is one thing, but pushing someone to engage in things that feel overwhelming can have the opposite effect. If a loved one is resisting social interactions or physical movement, approach with patience. Instead of saying, "You should get out more," try, "Would you like some fresh air together for a few minutes?" Sometimes, a small change in approach makes all the difference. Energy levels do decline with age, but when someone stops engaging in things they once loved, it's often a signal of something deeper. And when we notice it, we have the opportunity to respond with care, ensuring that the time they have is as comfortable and fulfilling as possible. Sign number 3. Noticeable cognitive decline or confusion. Mild forgetfulness is a normal part of aging. We all experience moments where a word slips our mind or we misplace our keys. But when memory lapses turn into persistent confusion, when someone begins to struggle with recognizing familiar faces, following simple conversations, or finding their way in once familiar places, it can be a sign that something more serious is happening. At first, the changes may be small. A loved one may forget an appointment or retell a story they just shared. But over time, the shifts become more noticeable. They might suddenly struggle to remember the names of close family members or pause mid-sentence, unable to find a word they've used their entire life. Conversations may become frustrating, as they lose track of what was just said or repeat the same question multiple times. Then there are the more alarming moments, getting lost while taking a familiar walk, putting everyday objects in strange places, or mistaking one time of day for another. You may notice them feeling disoriented in their own home, struggling to recall the purpose of certain items, or growing agitated when things don't feel right, but they can't explain why. These cognitive shifts can be unsettling, both for the individual experiencing them and for the loved ones witnessing them. When memory begins to slip away, frustration, anxiety, and even embarrassment can follow. Some people try to cover up their confusion, changing the subject when they realize they've forgotten something. Others withdraw, avoiding conversations altogether rather than risk making a mistake. This is why patience and structure are so important. One of the most effective ways to help someone experiencing cognitive decline is to establish a simple, predictable routine. Having consistent meal times, daily activities, and familiar surroundings can reduce the stress that comes with feeling disoriented. Even something as small as keeping objects in the same place, like ensuring keys, glasses, and medications are always in their usual spot, can provide a sense of security. The way we communicate also matters. When a loved one struggles to recall a name or detail, the instinct might be to correct them, but this can sometimes do more harm than good. Instead of saying, "No, that's not right," try gently reinforcing what they meant. If they call a grandchild by the wrong name, simply responding with warmth, "Yes, Emma loves spending time with you," can help them feel at ease rather than embarrassed. Speaking slowly, clearly, and with reassurance can also make a difference, helping them process information at their own pace. Encouraging brain-stimulating activities can be beneficial as well. Puzzles, simple word games, or even reminiscing through storytelling can help keep the mind engaged. Looking through old photo albums together, recalling favorite memories, or even listening to familiar music can spark recognition and bring moments of clarity. But perhaps most important is offering reassurance. When cognitive changes become frequent, they can bring feelings of fear and uncertainty. A person may know something isn't quite right but struggle to explain it. In these moments, the best thing we can do is make them feel safe. A calm tone, a gentle touch, or simply being present can provide a sense of comfort that words sometimes cannot. Cognitive shifts can be subtle at first, but they are one of the most telling signs that a person may be nearing the final stages of life. And when we recognize them early, we can ensure that our loved ones are supported, not just in their memory but in their sense of self, their dignity, and the knowledge that they are never alone. Sign number 4. Recurring infections or slow healing. The human body is remarkably resilient, constantly repairing and defending itself against illness. But in the final stages of life, these natural defenses begin to weaken. The immune system, once quick to fight off infections and heal wounds, slows down. This makes even minor illnesses more serious and recovery much more difficult. You may start to notice a pattern: frequent infections that take longer to clear up or small wounds that seem to linger instead of healing properly. A loved one who used to bounce back from a cold in a few days now struggles with lingering congestion for weeks. A tiny cut on their hand, something that once healed in days, remains red and inflamed for much longer than expected. One of the most common red flags is recurring urinary tract infections, UTIs. Seniors, particularly those who are less mobile or use catheters, are especially vulnerable. A UTI might not always present with obvious pain. It can cause confusion, fatigue, or even sudden agitation, making it easy to misinterpret. Respiratory infections are another warning sign. Pneumonia, bronchitis, and persistent coughs become more frequent, and each bout seems to take more out of them than the last. A simple cold that once required just rest and fluids now leads to extended bed rest, weakness, or even hospitalization. Even something as simple as skin changes can reveal how the body is struggling. Bruises appear more easily, and wounds, whether from a small scratch, a pressure sore, or even a surgical incision, take much longer to close up. When healing slows, it's a sign that the body isn't regenerating as efficiently as before. At this stage, prevention becomes just as important as treatment. Supporting the immune system through proper nutrition and hydration can help the body maintain its defenses as much as possible. Ensuring a loved one gets enough protein, vitamins, and fluids, even in smaller portions, can provide essential nourishment. Warm broths, soft fruits, and easy-to-digest vegetables can help without overwhelming the appetite. Hygiene is also crucial. A clean environment reduces exposure to harmful bacteria and viruses. Regular hand washing, sanitizing commonly touched surfaces, and ensuring fresh bedding and clothing can help prevent infections from taking hold. If a loved one is bedridden or has limited mobility, checking for pressure sores and ensuring they change positions regularly can prevent complications. Regular medical checkups become even more important as the immune system weakens. Doctors can catch early signs of infections, suggest treatments to ease discomfort, and recommend vaccinations or other preventive measures. Even if a senior is resistant to frequent doctor visits, gentle encouragement and routine health monitoring can make a significant difference. But beyond the medical aspect, there's another layer to consider: comfort and dignity. As the body slows its ability to heal, frustration and discomfort can set in. A senior may not always express their pain or frustration directly, but recognizing their struggle allows us to offer reassurance. Sometimes, the best care is simply ensuring they feel clean, warm, and cared for in a way that preserves their sense of self. A body struggling to heal is a body in distress. Recognizing this silent sign allows us to take steps that ensure comfort, prevent unnecessary suffering, and provide the care and attention our loved ones deserve. Sign number 5. A shift in breathing patterns. Breathing is something we rarely think about, until it changes. When a loved one begins experiencing irregular breathing patterns, it can be unsettling, but it's often a natural part of the body's transition. At first, the shifts may be subtle. Their breaths might become shallower, or you may notice them taking longer pauses between inhales and exhales. Over time, these changes can become more pronounced, sometimes following a distinct pattern known as Cheyne-Stokes breathing: deep, rapid breaths followed by moments of complete stillness. When you first witness it, it can be alarming, but understanding that it's a common part of the body's slowing functions can help bring a sense of calm. Another sign is labored breathing, even when at rest. A loved one may seem to be working harder to get air, using their chest and shoulders instead of breathing naturally from the diaphragm. You might hear a faint wheezing or notice their lips and fingertips taking on a bluish hue, signs that oxygen levels are declining. These changes happen because the body no longer needs as much oxygen as before. As energy reserves decrease, so does the body's demand for air. While this can seem distressing, The goal at this stage is not to fight the process but to ensure comfort and ease. One of the simplest ways to do this is by optimizing their environment. A well-ventilated space can make breathing easier. Opening a window for fresh air or using a small fan can create a sense of relief. Positioning also plays a key role. Propping them up with pillows, especially keeping the head slightly elevated, can prevent feelings of breathlessness. For some, lying on their side rather than flat on their back can also be more comfortable. In certain cases, a doctor may recommend oxygen therapy, which can help reduce strain if a loved one is struggling to breathe comfortably. However, in later stages, oxygen may not always be necessary, as the body naturally adjusts to lower oxygen levels. If you're unsure, a healthcare provider can guide you on the best course of action. But beyond medical interventions, one of the most important things we can do is simply be present. When breathing changes become noticeable, it's often a sign that time is growing shorter. Sitting beside them, offering a gentle hand to hold, and speaking in a soft, reassuring tone can bring a sense of peace, not just for them, but for those around them. Changes in breathing are one of the most important signs that we should be prepared to offer comfort and care in the best way possible. And while it's never easy to witness, understanding these shifts allows us to provide support with love, patience, and dignity. Recognizing these signs doesn't mean giving up hope. It means ensuring that a loved one receives the right support at the right time. It means making their environment as comfortable as possible, advocating for their needs, and helping them navigate this stage of life with dignity, respect, and love. Sometimes, it's about small adjustments, providing softer foods, offering more hydration, or simply holding their hand when words are no longer enough. Have you noticed any of these signs in a loved one? Share your experiences in the comments below. Your story could provide comfort to someone else going through the same thing. If you found this video helpful, take a moment to like, subscribe, and turn on notifications so you don't miss future content focused on the well-being of seniors. Every bit of support helps us continue bringing you valuable insights. Aging is a journey we all walk together. Let's ensure our loved ones walk it with comfort, dignity, and care.